Hello, good morning, everyone. Or good afternoon at this point on the East Coast. Thank you so much for joining us here today. My name is Aurora Grant Wingate. I work at the National Association of Community Health Workers as their member and partner engagement manager. I am so excited to get to work with some lovely partners today, Dia de la Mujer Latina and Vaccinate Your Family, to present celebrating community health workers' role and increasing vaccine equity. Please, as folks come in, feel free to introduce yourselves in the chat. We'd love to always hear, especially where you are from in the United States, so folks can see where folks are calling in from. Without too much further to do, I will get us started today. Today we have a really fantastic panel of folks to present on this topic. We have two amazing folks from Vaccinate Your Family, Marlene Ramirez and Grizel Cisneros, who will talk a little bit later about the vaccine navigator program. We also have Venus Jin S., founder and president of Dia de la Mujer Latina, who's going to be sharing a lot about the work she does. And I will close us out today to talk a little bit about NACHW's perspective on CHW's role in vaccination, a lot of the advancements and recognition that CHWs received throughout the pandemic. We will have an hour here together. We have 3 learning objectives, which will probably take us around 45 minutes to get through, which will be discuss and identify resources available to CHWs and promotoras from Vaccinate Your Family. Then Venus will come on to talk about identifying barriers CHWs face in their position in the workforce. And again, I will come in and finish up and talk a little bit about CHW's roles during COVID. We do hope to have 15 minutes at the end for a Q&A. We do have Q&A function enabled here on Zoom, so feel free to throw questions in there or put questions directly in the chat throughout the presentation. Without further ado, I will be handing it over to Grizel to start talking about the Vaccination Community Navigator Program. Thank you so much.
Thank you, Aurora. It is my pleasure to be here. Hello, everyone. Good afternoon, good morning, if there is anyone who is still on that time zone. We are going to start talking about the Vaccination Community Navigator Program, the VCN for short. And for that, I am going to have my colleague Marlene Ramirez take the lead, and then I will be back with you to talk a little bit about respiratory season and the vaccines recommended for this fall. Marlene, go ahead.
Thank you, Grizel and Aurora. Let's go ahead and start. What I'm going to be sharing with everybody today, I'm going to be talking about the Vaccination Community Navigator Program, which is also known as our VCN program. As community health workers, we know that we're always looking for resources and trainings to help us improve the services that we are providing in the communities that we serve. And that's exactly what we did here at Vaccinate Your Family. We developed this program, which is the VCN, to help with that, to help community health workers and provide them with a tool when they're out there having these conversations, and we're targeting vaccine hesitancy to help gain that confidence. So a little bit of background. This program, it's the first of its kind. We built this based with the help of community health workers, but promotores de salud, okay? So we piloted this program back in April through March of 2022. We launched it here in Texas with the help of community health workers, promotores de salud, and community health worker instructors. Based on that feedback and what we saw, we then decided to launch it at a national level, which we did in February of 2023. Over the next slides, I am going to be talking more in detail on what the VCN program itself is. We're going to be going over 4 pillars that consist of the program. So with that being said, can we go to the next slide, please? Okay, so let's go ahead and start with our first pillar. I want to say before I get started into talking a little bit more about the VCN program, I do want to say, even though this was built by community health workers for community health workers, it is available to everybody. Okay, it is available to everybody, especially those that are on the ground having community conversations around vaccines. Okay, so let's talk a little bit about how those online courses look. So for our first pillar, we developed an online program, which consists of 4 courses. When I say we did also this in partnership with the Mujer Latina. And what we wanted to accomplish with these courses, we wanted to make sure that community health workers and professionals that are in this field felt confident when having these conversations. The 4 modules that are included on these online trainings, talk anywhere from like the past, present, and future of vaccination, the nuts and bolts of vaccines, how to debunk misinformation and bolster vaccine confidence. And we also talk about the social determinants of health and barriers to vaccination. So this is what our 4 modules consist of. Again, they are available for free online. Everybody can access them. All they have to do is go to the link that we see on the screen, which we will share. We'll make sure that everybody gets access to this. These courses are available in English and Spanish. They are working at your own pace. So next slide, please. Okay, so because we know that sometimes technology can be a barrier, right? It can be a barrier. Maybe it's a rural area that we're working with, or sometimes we know that not everybody might do well with an online training, right? So with that in mind, we decided to add a second pillar to the VCN, which is our in-person facilitation. So basically what this is, it helps us bring the VCN to an in-classroom setting. So how did we do this? We partnered with other organizations. For example, this year we had our first cohort of the in-person facilitation. We partnered with a total of 7 organizations, which totaled to 23 nationwide facilitators, where we reached about 450 community health workers that were able to go through these modules in an in-classroom setting. Again, we created a facilitator's guide to support these organizations, where we offered that tech support. And for some organizations, we were able to offer that financial assistance for them to host these classes in their areas. For future updates and possibility of cohort number 2, we do invite you guys that are here on this call to join our online community for the latest updates for our in-person facilitation pillar of the VCN. And I will talk a little bit more about the online community in the next slides. Next slide, please. We wanted to make sure that I said, like, we had these online trainings, but we wanted to continue the learning by offering our community of practice meetings, also known as our COP meetings. Now, these meetings are held quarterly. We do get feedback from participants as to what kind of topics they would like to learn. Our next one will happen in December, and this is just another learning opportunities where not only community health workers, but others can come in, discuss important topics, and it's also an opportunity to share information, ask questions, connect to resources, and share best practices. These meetings are held in English, but we do have live Spanish interpretation. Next slide, please. Now I'm going to talk a little bit about the online community. So we didn't want, can we go back to the previous slide, please? Thank you. Okay, so now we didn't want the learning just to stop with the online modules and the community of practice meetings. We wanted to make sure that we provided those that participate. We wanted to provide a safe space, and we created our online community. Now, again, this is a free online space for community health workers and anyone pretty much looking to network and also have the the access to connect to services, information on vaccine preventable diseases, share resources, and in case there are events or trainings that are coming up that people will want to share in the community, this is an opportunity to do that. So we did develop this fourth pillar of the VCN program, again, which is our online community. Now, and this is available again for everyone who would like to register. Again, the community is handled in both languages, in English and Spanish. And we definitely want to take this time to continue to invite everybody on here to join, whether it's the online modules, definitely join our community of practice meetings and our online community. And with that being said, with the information on the fourth pillars of our VCN program, I do want to hand it over now to Griselle so she can go ahead and talk about our VCN program results.
Thank you, Marlene. And thank you for walking us through the components of the VCN program. I hope everybody is encouraged to check it out and see if the modules are something that you and your community can benefit from. I wanted to stress the fact that everything is free of charge, and also the fact that it is bilingual. So it is available in both English and Spanish. So I wanted to discuss the results of the VCN, because one aspect of it is that we have made a big effort to make sure this program is evidence-based, that we're collecting data as a pre-test and then as a post-test. So thanks to that, we have some pretty solid results where we see that people are gaining knowledge about vaccines, and they're also gaining confidence in speaking about vaccines. So those are the two parameters that we're looking at when we're going through the pre and the post test at each module. So since the program was launched, we have more than 700 students enrolled in the vaccination module. So that is a pretty good number. We have managed to promote it at events like this, invite people that we partner with to really join and share this amazing training that is available for community health workers, community health worker instructors, and anybody who is interested in vaccines. We have, like Marlene mentioned, our quarterly virtual meetings, and we have about 100 people attend every time. So the next one is coming up in December. I will make sure to send out some links for anybody who is interested in joining us then. And then finally, our VCN online community. That space, again, free, open to all. You can register anytime. And that space has about 470 members so far. We connect, we share best practices, we talk about relevant events. You can post questions of any sort. So these are, just a little bit of information regarding the VCN and how we have seen results. And we continue to see the enrollment numbers go up. So we hope everybody is enjoying it, and we're working to make it better and to improve it and to update it with some of our new content and new vaccine recommendations. I see a message in the chat asking for the links. So yes, I will go ahead and include those so that everybody has them here handy. I know we went through them on the first slides, but I will pop them in the chat as soon as I'm done talking. Next slide, please. All right, so now we're shifting gears here. So we've talked about a great program that helps us learn about vaccines and be more comfortable talking about vaccines in our communities. So what does the VCN look like in action, right? Like, how can that actually help us? So we decided to include a couple of slides about the respiratory season. I know that is on everyone's mind today and possibly for the last 2 weeks or so. We started seeing all these signs at pharmacies, come get your shots. We've all heard or met someone who came down with COVID for the second or third time. So we are really entering that time of year where it's not only about pumpkin spice lattes, but it's really about the sneezes and people being indoors and being in places where we can catch anything and everything. So on your screen, we have a table that really runs through some symptoms and really tries to explain, well, what is it? Is it a flu? Is it a cold? Is it COVID? Is it RSV? Because that's the new thing that has been thrown into the mix this year. So it's difficult to tell, and many times we will not know until we get tested. But this is a bit of a guideline. So it talks about, you know, what do we see with allergies? What do we see with a cold? Do we see a fever with COVID? So this is something that you can have as a resource, not only to consult yourselves, but also to really understand the difference between all these respiratory illnesses that we're looking at. Again, respiratory season does include flu, COVID, and RSV, which is the respiratory syncytial virus. And this is something that we do have vaccines for all three of these. And that's what I'm going to go in on our next slide, please. All right, so recommended vaccines for respiratory season. For the first time in US history, we have vaccines for COVID-19, flu, and RSV available to us. We need to make sure that we are up to date on our vaccines and that we do talk to our providers about the availability of these vaccines for specific groups. High levels of vaccination across our population will help reduce the number of people who get hospitalized from these respiratory illnesses and obviously reduce hospital strain. So as a very general recap, a reminder, flu and COVID vaccines are recommended for all. We will go a little bit into more specifics in some of the links I'm going to provide, but that's just an idea. We should all be getting COVID and flu vaccines. RSV vaccines are recommended for infants, toddlers, pregnant people, and older adults. There are some specific recommendations in terms of when to get those vaccines that can better be addressed by your provider. This link right here is from the Centers for Disease Control, and it really gives us an outlook. I really encourage people to take a look, take a peek, and better understand what we're looking at, what this new season brings, and how to incorporate vaccines into our discussions, in our communities, into our families, and really make that, that difference in knowing what we should be getting as soon as possible to help reduce the respiratory illnesses that we may come down with. Next slide, please. Okay, so I know we've talked about everything that we can get, but what can we do about it? Is there anything we can do about it? And all of this is going to sound very familiar to most of us. So this is something, again, put out by the Centers for Disease Control, and it's a guidance snapshot on the things that we should be doing as our core strategies. And I love the fact that number one, right there, we have immunizations. So let's all stay up to date with our shots. Let's get our kids vaccinated. Let's encourage our parents to go get their vaccines, family, friends. Second, we have hygiene. Steps for cleaner air, ventilation. We've heard it since we dealt with the pandemic. We became a little more aware of these things, maybe we can have an air filter, we can step outside and try to ventilate our spaces. Then obviously there is treatment. There are certain people who qualify for treatments for any given illness. And then the most common one, which is stay at home to prevent the spread. So those are the core things we should all be practicing as prevention strategies. And then, of course, there are additional strategies for those who wish to wear a mask, the distancing, and then testing if you have been exposed, or if you traveled, or you feel like you need to get that test and find out ASAP. So these are just, I like this slide because it really summarizes a lot of information in one little colorful slide that, again, we're going to go ahead and share with you. And this is something your population may use, may distribute, and may really come back and take a look at as we enter this season of respiratory illnesses. Again, there's a link on it that you're more than welcome to access and peruse that information there at your leisure. Next slide, please. Okay, so I've mentioned a couple of the resources that are available on those links. I also wanted to direct this group to the Vaccinate Your Family website, because we have plenty of resources that can not only increase our knowledge, but can also be downloaded and shared for free. This is what our site looks like, and this is just a little snapshot. The address is there, vaccinateyourfamily.org, and we have a whole section with vaccine resources. Once you click on that, you will access many different types of materials. Right here, I've included 2 flyers, 1-page flyers that we have available to download in English and Spanish. One is the vaccines during pregnancy, and the other one is talking with people about vaccines. And these are very user-friendly, colorful items that have really been developed to be as well received as possible by our populations. They do not include any information that is too technical or anything like that, but it just tries to communicate the importance of vaccines in a very friendly, easy to understand way. So I encourage everyone to visit this site as well. Again, as soon as I am done talking here, I am gonna send the links in the chat, and then hopefully, Aurora, we can include those on your follow-up email, just so people can have them handy in their email and not hesitate to go to the VCN modules, to the online community, and obviously to the Vaccinate Your Family website to access all these resources. Okay, next slide, please. All right, so speaking about the VCN in action, right? So we've gone through some of the respiratory recommendations. Now we are gonna go back to Marlene and go through a little case study. Marlene is gonna really tell us from her perspective how she has used the modules and how you possibly and hopefully may be able to use them in your context. Marlene?
Thank you, Grisel. So I'm going to talk a little bit about, I guess, my personal story as a community health worker and how I put to action the VCN and the resource, right, when I found out about this resource. So as a community health worker, my role was to be a health educator. One day I was told that we were going to be going into the topics of vaccines. Honestly, I didn't feel that confidence in the community to go out there and have these conversations. But I can honestly say that after I came across the VCN and participated in the modules, that definitely increased my confidence as a community health worker, as a health educator, based on what I've learned with the VCN. And I just say this just because the modules, the way that these modules were put together, thinking about community health workers for community health workers, when I was playing that role with that organization, I felt that confidence in going out there in the community. And this is something that we definitely want everybody in this call, if you're a community health worker, to have that confidence after participating in these modules. If even if you're not a community health worker, just when you're out there having these conversations in your community, we want you to feel empowered. And as this case study, I can honestly say that is what the VCN did for me on my end as a community health worker. And I continue to present that invitation to everybody on this call to have that opportunity, go look at the modules, participate in the modules, and also if you work with other individuals who might feel, that they need a boost in confidence or a refresher in the topic of vaccines, share this resource that's available with them. And with that being said, I'm going to go ahead and pass it over to Venus Hines from Dia de la Mujer Latina, who is also very important and plays a very important role in the world of community health workers. So, Venus.
Thank you so much, Marlene. And first and foremost, I want to thank Vaccinate Your Family for actually having this module and providing all the resources for us to be able to put together such a wonderful piece of work. I'm telling you, Robin and I worked on this for months before we were able to launch it. And I thank also NACHW for actually recognizing how important this topic is, especially for our community health workers and promotoras de salud. So as you could see, expanding the role of promotoras and community health workers has been something that has been my mission and passion since 2011 when I started my first training program here in Texas for instructors, because we wanted the instructors to know how to be able to raise these questions for our community health workers before developing a training. We wanted to know where they were, at what place they were in their journey, and how we can best support them. And our organization actually started having conferences, and all our conferences were titled Expanding the Role of Promotores and Community Health Workers, because we knew that they are the key cultural influencers in our community. They can really move the needle and get people to understand something in plain language, as opposed to debunking all this information that we've had to do in the last few years because of the misinformation and also because of the conspiracy theories. So some of the barriers, and I think for right now, you could see our training program since 1997 has built on a framework of MINE, M-I-N-E, motivar, informar, navegar, y educar. In other words, motivate. How do we get our people motivated to get screened or to get a vaccine? How do we inform them where the local resources are? How to navigate them? Community health workers and promotoras are amazing navigators in the area of cancer and diabetes management. And now we have, all of the issues that revolve around COVID. They've been absolutely wonderful. And then you educate. How do we educate our community in a way that they can understand the information in a culturally and linguistically appropriate manner? That has been our framework. And next slide. And this is what we've done. Our trainings we've empowered community health workers to become clinical trial community navigators. Behavioral health community navigators is another role that many of our community health workers now have found workforce opportunities under that. We've also been hit, especially in Houston and in Texas, with some disasters especially Hurricane Harvey, where community health workers and promotoras were beginning to be recognized as a force of nature. Those are the ones that you can rely on to get information and to be able to provide the resources that our community needed. The one that we've been working on, and you will all hear about it pretty soon, is our patient-centered community navigator. Many of our community health workers went with us in April of last year, and we advocated to our legislators about expanding the role of community health workers, going from administrating to care coordination with Medicaid. And we achieved that. And the governor signed the bill. And here we are now looking at ways that we can promote our community health workers to become patient-centered community navigators. And then, this is just some of the things that we've been doing. I want to go over to the one that says Vaccination Community Navigator. I had developed a program where community health workers who have taken the training, we provided scholarships for them to take the pharmacy tech training and be certified as pharmacy technicians so they can also be vaccinators. We ran into an issue because there's a huge group an association, let me just say, the big group of folks who really feel a little intimidated about community health workers coming into their arena. And that's some of the barriers that we have seen. In the beginning, it was because no one knew what community health workers did. And now we're facing the fact that we're threatening some positions, and that's not true. We're there to support. But for many who really don't understand how the role of community health workers and how much they can be of assistance and value to our community, especially in times like this, they become intimidated by us. And so that pretty much stopped us in our tracks as far as continuing on to expand the role of community health workers as vaccinators. It's not over yet, but it's something that I'm still working on, and it's going to take a little bit longer. We just have to wait until its Texas legislature is in session for us to try to do that. Once we do that in Texas, we hope to bring it all over the country for other community health workers to understand how important it is to put together these talking points and bring this to policy and making sure that they also have a role in vaccination. Next slide. Now I'll turn it over to Aurora.
Thank you so much, Venus, and thank you so much for talking a little bit about the opportunity that we do have in the future for community health workers to they themselves be vaccinators. Thank you so much for the folks who have been participating in the chat. It's been great to see folks responding to these resources. I'm really here today to close out our presentation and really talk about what has happened in, let's say, the last 5 years for really recognizing community health workers' unique role as vaccinators. Obviously, this is not something new for community health workers, but it was often new for those outside of the community health worker space to really understand how crucial community health workers can and were to helping folks get vaccinated. NACHW was really founded and came of age during COVID-19. We are founded in April 2019, and our executive director, Denise Smith, was brought on in 2020. So many of our first opportunities were really around the COVID-19 pandemic. Here on the slide, you can see some of our members and founding board members directly serving community members on the front lines during those first months of COVID, whether that was delivering masks or handing out materials on the street. And we heard so many of these stories. And what we also saw in sort of real time is community health workers rose and met every occasion of the pandemic, started with supplies and being on the street. And as soon as vaccines were developed and available, community health workers were also on those front lines. And what we also saw is that there really was unprecedented funding and recognition for community health workers throughout the federal government. Now, none of this was without barriers, without critique, but it was some of the first times that community health workers were being acknowledged by presidential offices, by different federal agencies. We saw community health workers included in early drafts of the American Rescue Plan, were cited in the COVID-19 Health Equity Task Force and the National COVID-19 Preparedness Plan, and so many more. And what we want to do at NACHW is really remember and capture that moment. And as we move forward with other pandemics, with other health endemics in this country, is to remind those leaders in the offices that community health workers, just as they were critical to COVID, are critical to further vaccine efforts, for further issues of health equity as well. And that's part of the reason that remembering that they themselves sort of said that community health workers were so critical is really important for us to acknowledge and celebrate going forward, as well as continuing to lift up and advocate that funding continue to go to community health workers to do incredible work in getting folks vaccinated and other realms of addressing social determinants of health. Throughout the pandemic, NACHW has really tried to put forward some recommendations that again recognize and celebrate how community health workers help build equitable vaccine infrastructure. really looking at the role that CHW associations can and have played in recruiting, hiring, training, and supervising CHWs to do vaccine communications and distribution work. That CHWs can and have developed, distributed, and evaluated materials and strategies around misinformation, around vaccines, and that CHWs can navigate technology, literacy, language, enrollment, and transportation barriers to ensure access to vaccines and healthcare coverage. This is one of the most common things that we were telling partners and that community health workers were telling us, that you need to allow community health workers to address those social determinants of health and other barriers they have to allow community members to access vaccines. And this gets into that final point that CHWs can coordinate and administer screenings for food, housing, financial needs, and mental health services around vaccine distribution as well. Again, throughout the COVID-19 pandemic, to really continue to lift up the important role that CHWs were playing, we worked with so many great partners, from the American Diabetes Association to the Association of State and Territorial Health Officials, and so many more, to really, again, showcase the stories of community health workers, the work they were doing at the front lines to combat misinformation, to bring the correct cultural resources and language to community members. And what's come out of that, it really is hundreds of stories and testament, and sometimes real studies about the difference that community health workers can play in vaccination and health equity. And as much as we have been able to, we have also tried to capture some of this knowledge and what community health workers have brought to us in some reports and some toolkits that we want folks to be able to use, that have examples and recommendations as you might go into your community or with funders to, again, advocate for community health workers doing this work and to get funding for community health workers to continue this work. I have 3 reports here. One is Community Champions in COVID-19 Vaccination. This was a survey we did sort of early on in the pandemic, sort of at the first round of COVID-19 vaccination, seeing what were those initial barriers that community health workers were facing. And then we sort of built on that with another report, From Crisis to Opportunity: Resources and Guidance that CHWs want from employers during the COVID-19 pandemic. This was, again, another survey, but really tries to get at what can employers do to better serve and uplift their CHWs who are doing work within COVID-19. A lot of that was around vaccinations and the resources and tools that community health workers need. A lot of that often looks like listening to CHW leadership. One of the big reasons community health workers do this work so effectively is that they know community and they have the trust of community. So making sure that you are helping community health workers lift up their voices in this work. And lastly is a toolkit that NACHW worked on with many other fantastic partners in the Community-Based Workforce Alliance around advancing CHW engagement in COVID-19 response strategies. This is a playbook for local and state health departments, but has a lot of great recommendations and resources for any organization that's looking to employ or train CHWs. It really has so many great recommendations on areas on hiring and onboarding, and building partnerships and lifting up CHW leadership. So we really recommend folks check out some of those resources if you are in that role of hiring CHWs. That's all to wrap up our presentation today. We'll now move into some question and answer time. We'd love to hear from folks in the audience. If you have questions about anything that's here today, if there are other resources that you think community health workers need to know, I'd love to make some space for you all. are there folks here, folks who respond in the chat, who are currently working on educating about vaccines in their community? Or will this be folks' first time? Oh, thank you.
This will be my first time, and I had a question. My name is Caroline Fofana. I'm from VOA of Texas in the DFW area, CHW. And after you go through the training modules for the VCN, is there a certification provided? I mean, how are you credited for credentials?
Marlene, would you like to address that? Caroline, you do receive a certificate of completion, and you do receive continuing education units. However, the actual certification is unique to every state. And because Marlene is in Texas, I'm going to let her elaborate on this and see if there's anything that would be more applicable to your location.
Yes, thank you, Grizel. So as Grizel was mentioning, everybody that does complete the modules, at the end, they do get a certificate of completion, right? Like I mentioned, these modules are not only a learning opportunity and increase in confidence, but they can also serve as professional development, right, for staff. And like Grizel was mentioning, it does offer continuing education hours for community health workers, but right now that is offered to those that are in Texas because it has been certified by DSHS as a continuing education hour curriculum.
Marlon, this is Venus. I also want to add to it. It's our organization that has the certified program with the state of Texas, and it's 8 hours. So it's 8 hours of CEUs.
Thank you.
Thank you, Caroline. I see other folks have been dropping in the chat some of the ways they will be or want to start talking about vaccinations. I see someone put, I host vaccination clinics with our local county health. Someone else wants to be sharing accurate information on Facebook. Someone else has recently been tasked with doing a presentation for respiratory illnesses. I know there was another question in the chat around becoming a certified CHW. As Griselle said, that sort of varies from state to state. I would always recommend reaching out to your local or state CHW network. If you need help finding or getting connected to that organization, please feel free to reach out to me or info@NACHW.org. We're happy to get you connected to the right people. Let's see, does anyone else have questions or want to share a little bit about the vaccination work that they are doing or hope to do in these upcoming months? Folks can feel free to drop it in the chat or come right off mute.
This is Caroline again. I have one other question. So after we have gone through the modules and gathered all the information and knowledge and thus for, so once we get ready to present it to the communities, are there pamphlets that we can provide the community members or the community as a whole?
Yes, so every module has a section of resources. So at the end, you will have access to those in basically one place. Again, you know, some of those tend to be a little more state specific. For example, those that navigate people to getting free vaccines, for example, do depend on your state. But we have gathered under the resources section materials and links to places where you can download materials that would be applicable to the topic. As Marlene said, there's 4 topics, so there's resources for each. A lot of the resources that you will find there are developed by Vaccinate Your Family. And, we try to update them constantly to make sure that, for example, at this point, they reflect RSV, which was not the case when the modules were initially launched. So my answer to Caroline would be, it's a good starting place to access those resources and use them when you're talking to your community. Now, how specific they're going to be, I'm not sure, because obviously this is a nationwide program, so we can't cover every pocket. And I know some services can be county specific or state specific. So I think it's a really good starting point. And then if you can enhance that with something that is more relevant to your community, that would be ideal.
Thank you so much.
And
Thank-
just add, we also want to invite everyone to our website where there are additional resources as well. Go ahead and put our website in the chat.
Thank you, Marlene. Let's see, does anyone else have questions? I know I saw one question in the chat about receiving certificates from this training. And Dia de la Mujer Latina has offered a 1-hour continuing education credit for folks who are certified in Texas. Other folks will also receive a certificate of attendance. Please take our brief survey monkey that I'll drop in the chat, or that will pop up once you leave the meeting. That's just an easy way for us to know you would like a certificate. Let's see, I don't see any other questions in the chat. Thank you, Marlene, for putting the link for Vaccinate Your Family in the chat. Does anyone else have any questions?
Or this is Venus. I also want to share that we offer the 1 hour of CEUs for the community of practice. So in December, those interested, you'll get 1 hour as well.
Thank you, Venus.
I'm sorry, I do have one more question. This is Caroline. But this one is directed toward Miss Venus regarding the pharmacy tech that she mentioned is halted for now. Are they trying to construct a course that would go hand in hand for the CHWs to take, or is this something just totally separate from CHW certifications?
Great question. You have to be a community health worker, and the questions, they have a pre-test to see if this is something that they can go ahead and allow you to take the training. And this is a pharmacy tech school. And once they approve and you pay the fee, then you still have to take the training and then get the certification from the state. And that's where we were going. And the 4 community health workers that we sponsored all got their certification from the state to be pharmacy techs. And as you know, Governor here in Texas, Governor Albert has allowed pharmacy techs to vaccinate up until December of 2024. So because of that short window, our advocacy had to be halted for right now until the legislature, and then we're going to go full stream. And hopefully you'll be hearing from us. Those in Texas will be hearing from us, because we'll need your help to get the message out that we as community health workers can do a lot of things, including vaccinate our community, while we're educating them and navigating them at the same time.
So Miss Venus, just to follow up, so where do we go to just keep abreast of that? Because I am in Texas.
So, actually, I'm going to be working with NACHW and Vaccinate Your Family. They're both on this with us. And so once we get that information, I know Aurora will put it out in her newsletter, and we'll have it posted both on our website and Vaccinate Your Family. So we'll keep you, especially now that we know you need an hour from us, we'll put you on our database.
Thank you, Caroline. Those were all excellent questions, so we appreciate it.
Yes, ma'am. Thank you.
See, we have a few more minutes. Does anyone else have any questions? Hey, if not, we can give folks 10 minutes back. We really appreciate you taking your time to come and be with us today. I hope if you are a community health worker doing vaccine work that you feel recognized and that you have some new resources and a community to come plug into to get additional support. Thank you so much for coming and engaging. We look forward to seeing you all at other events. Yes, this recording and all the materials links will be emailed out to all of you. So thank you. I hope everyone has a safe and healthy rest of your fall. Thank you.